Welcome to Integrative Medicine Perspective. I'm Dr. Wendy Liu. Annual health checkups have become a routine part of preventative care for over 100 years, but there's still a lot of debate over their actual benefits. Shocking, right? Regular checkups should detect issues early, address them promptly, and prevent diseases from progressing, which should be good for health and longevity. So why the controversy? But surprisingly, the opposing views do have some merits. So let's dive into some key studies on how regular health checkups impact disease occurrence and lifespan. A 2012 Cochrane systematic review and its updated 2019 analysis came to the same conclusions. Despite regular checkups leading to more new diagnoses of chronic diseases, there was no reduction in the overall morbidity or mortality from either cardiovascular diseases or cancer. A 2021 systematic review published in JAMA, which included even more data, also reached the same conclusion. Why do these large data analyses show that regular health checkups don't reduce morbidity or mortality? It's quite contrary to our expectations. Are we just wasting our time and money with these regular checkups? Let's explore this with a few analogies. Imagine an experiment with cars in a crowded parking lot, prone to minor damage like scratches and dents. We split the cars into two groups. One gets checked weekly and any issues are immediately fixed, while the other group serves as the control. After a month, we compare the conditions of the cars. The weekly checked cars have fewer visible damages at the end, but the total number of damage marks over the month is the same for both groups. So can we say weekly checks prevent car damage? We actually can't, because the number of total damage marks is the same between the two groups. But do they help in early detection and early repair? Yes, they do. So is weekly checking good or not? If our goal is to have no damage marks on the car, then yes. But if our goal is to prevent the damage altogether, then no. The weekly checks and repairs do not change the risk factors these cars encounter. Now let's tweak the experiment. The weekly checked cars, upon finding damage, are also moved to less crowded spots to avoid further damage. After a month, these cars not only have fewer visible damages, but also fewer incidents of damage overall. Can we conclude that regular checks help prevent damage? We still can't. These two experiments tell us the importance of risk reduction in preventing damage. Now, finally, let's consider an experiment where both groups of cars take all possible preventative measures from the start. One group gets checked weekly, the other monthly. After a year, there's no significant difference in damage between the groups. This suggests that if risk reduction is carried out effectively, frequent checks may not be necessary. Do similar experiments exist in clinical medical research? Yes. Most of the studies are very similar to the first two experiments. If our regular checkups primarily focus on early detection and early treatment, they may not reduce disease rate, similar to the first experiment. Consider colon cancer risk, for example. Which risk factors can screening methods like a colonoscopy reduce? None. But if the result of early detection also leads to risk reduction, similar to our second experiment, it helps prevent recurrence. This is known as secondary prevention. Primary prevention involves taking measures to reduce risk factors before disease occurs, like our third experiment. When primary prevention is effective, frequent checkups might not be needed. Such studies are rare but crucial to guide how we use regular checkups on top of primary care. Of course, our bodies, lifestyles, and environments are far more complex than cars and parking lots, but these examples highlight the importance of primary prevention, primary risk reduction in disease prevention. Current research suggests that regular health checkups aid in early disease detection, early treatment, and possibly secondary prevention, but haven't proven to be better than or as good as primary prevention. Thus, the main focus of disease prevention should be primary prevention, and regular health checkups should not be seen as a true preventative measure. Plus, disease development is a process. A normal checkup result only means no visible disease at the moment, but doesn't inherently stop any disease process at its early stage. That's all for today's discussion. Please leave comments and questions. I will see you next time.